For a pediatrician, my biggest advice would be to talk to your patients, like Chris was saying. Let them know at their level what's going on and what you're doing procedure-wise. I think also as an adult, I want that same respect. I want my doctor to say, okay, this is what's going on, this is what I'm going to do to treat it, and this is why. Medical terminology is not my language, and I'm not a child, but I do, I don't want to hear all these big medical terms, but I also want to know what's going on. I don't want to be talked to as a child, but as a normal adult. And I think doctors should talk you through what's going on and what's going to happen and be open about that, even if it's bad news.
Try to ask some questions that would make you, as a doctor or care provider, that your patient understands what's going on. Maybe talk simple and kind of quiz the patient to, because sometimes you could be like, yeah, I'm losing my sight. Well, then, do you know why you're losing your sight? Do you know what's happening to your eyes? And make the kid tell it back to you so that, he or she knows what's going on and what's the possibility, because as long as they know it, that, as long as the doctor knows, the child knows what's going on, then that can only mean that they're going to do better with their situation.
I had some questions about future situations around the time that you start to question about your body and things, whether I could have children and things like that, but you just don't feel comfortable asking it when your mom's right there because she doesn't even know you're thinking about it, or she doesn't think she knows, but I think if the doctor takes a moment to realize that the child is in the portion where they would start to think about sexuality, maybe take a moment or encourage the child to ask questions, or maybe ask the parent to step out of the room for a minute. So
it's important to talk to the patient and make them aware of what's going on so they understand, especially with medications and things. If you're trying to be independent and living out on your own, you can't rely on someone else to always measure up your doses for you. So I think it's just important that the doctors tell the patients what's going on and focus on them, because they're the ones with the disability.
It was hard for me to find a doctor once I moved away for college, um, to know what is a good doctor to pick and what type of doctor I needed for what I was doing. So I guess getting more information on how to find what type of doctor I was looking for would have helped a lot. And also, once I got there, I just assumed they're a doctor. They'll know that I'm blind and I can't see and this is my needs. But to realize that even though they're a doctor, they don't specialize in my disability, so they're not going to know what I need, and I'm still going to need to let them know how best to serve me and how best to help with my situation, like helping fill out our reports and paperwork and helping me to find where an empty chair is. Just simple things like that. I just assumed when I went to a doctor's office they would know I can't see, so they would show me where an empty chair was, and they didn't.
It's funny, like I got a story, like I went to an eye doctor, a new one, and they were just so worried that, they couldn't, I told them, the nurse that I have RP and stuff, and, I had a vision impairment, and for some reason she didn't relay that to the doctor, but the doctor started checking my eyes out, and he just started panicking, like he kept coming in the room and out of the room, in the room, asking me these questions, and you could just tell something was wrong, and I was like, what's he doing? And he was, he kept asking me these questions. I was like, I have RP, right? And he's like, oh, thank God. I was like, he was just like, he didn't want to be the one to have to tell me that I'm, we're going to go blind. And what he was doing was tracing my history instead of just being like, telling me if no, I think doctors do that. They kind of want to make sure they're not going to have to be the one to tell you, and I think they could have been a little more, I'm an adult, I can handle it. I mean, of course you can be a little tactful, when you do it, but you don't have to be like, oh, buddy, you're going blind, or, you can just tell them what the situation, what you're finding, what you're seeing. Talk to me as you're looking through my eyes, what's going on through your head. It's only going to make me like you more as a doctor and come back to you and really believe in what you're doing.
If I have a white cane, obviously I'm going to need a little assistance, and so if you can just kind of be aware of your patient's needs and kind of just, I don't know, be conscientious of things like that.
And then the other thing is knowing what programs are out there for you to attend, as far as learning, maybe bouncing your checkbook, or mobility around the city, just different things. Just knowing what's out there and what's available is very important.
There's been times when I've had to wait a little while after my appointment for my ride, and I have a little girl, and she always sees the toys in the waiting room and wants to play, but I don't dare put her down because I can't find her again. And so my doctor has let me sit in the examining room, and there's always little toys in there too, so I can shut the door and let her play for a few minutes, and that's been really helpful. Just little things like that make a visit so much less stressful.
One thing is how to explain the disability in layman's terms. I actually had to research it myself a little bit when I started to get interested in it. My mom kind of, because I lived a life of quote-unquote normality for so long, and I'm like, what's this kind of surgery? What happened here? She doesn't remember. So something like asking the doctor to explain it to me in layman's terms or something. And now that is my responsibility to ask, but when you're younger, even when you're 5 or 6, if the doctor can explain, this is what's going on, then you're more likely to understand what your disability is when you get older.
With me, I don't know much about, how my body was growing up, other than I had eye disease and I was losing vision. But to know exactly what my eyes were going to do when it was, I never knew all that information, and my mom did, and parents sometimes, they're selective on what they want to tell you, and I think it's best to know all the possibilities up front. Losing vision, what are the statistics, but really encourage them to live as healthy of a life as you can, because you don't want to scare them into a state of depression where they're just going to give up on life at a young age, or because there's so much out there to look forward to and that you can do with disabilities, that it's not as bad as it could be.
Well, on a personal level, I have dealt with depression, and one of the greatest things that I found out to deal with it is to get out there and do things that you don't feel like doing, but you really get outside. When you don't feel like going outside, you just have to get outside to stop yourself from feeling nasty. Go for a walk and realize that there's an outside world that you're part of, and you need to be out there and realize that there's assets and positive situations out there. There's going to be negative times, and I've been dealing with depression for years, and I still get it. And I often wonder if it's related to the disability or if it's just, a biological issue for me. I really don't know, because I have kind of come to terms with my disability, but I still deal with it sometimes. And I think the part of it is cabin fever, because I don't get out enough. But once I get outside and go and realize that there's other things out there, I usually can get myself back into the groove of things.
Parents and professionals need to encourage children to be able to take responsibility, but also be able to step back and watch and make sure that they're following through, so that when they are adults, they already know how to be able to self-motivate themselves to do what they need to do. And everyone's going to make bad choices. Everyone does, whether they have a disability or not, and we just have to learn from those bad choices. But if we can learn to keep going and think things through and be responsible before we have to be responsible, that's what needs to be happening.
To me, all of these tips come down to the idea that people with disabilities may present more of a challenge, but ultimately their goals, everything that you do as parents, as physicians, is going to be fairly similar for someone who has a disability or doesn't have a disability. They just present additional issues that you need to work around.